Good morning and welcome to Radio Friends on Wednesday, April the 22nd. It's good to have you with us today. I'm in my home talking to two of our guests about the Mid-Missouri Kidney Walk. I want to introduce you to Kathleen Davis and Dr. Kunal Malhotra. Good to have both of you here. Now, the Mid-Missouri Kidney Walk was scheduled to be held later this month, but that's been postponed for now, correct?
Yes, that's correct. Thanks for having us, first of all, Paul. Really appreciate it.
You're welcome.
The Mid-Missouri Kidney Walk, it has been rescheduled to Sunday, September 27th. It's still at Stevens Lake Park, and check-in is at 11, and the walk will begin at 1 p.m.
Now, the purpose of this walk, besides raising money for the Kidney Foundation, was also educational.
Correct, yes. We want to raise awareness at the Kidney Walk, and we have three events, a golf tournament, gala, and a walk. But the walk is really to reinforce our efforts to raise awareness for kidney patients and to show our support to them at the walks and their caregivers.
How many people in our area are affected by kidney disease? Do you have that information?
Well, Dr. Malhotra, I'm sure, would be able to help with this as well, but I know that 1,100 people in Missouri, roughly, are on the kidney transplant waiting list.
Thanks for having me. Firstly, I'm a nephrologist at University of Missouri, and we know from national statistics that about 14 to 15% of adult Americans have chronic kidney disease. So that's a huge number, and millions of Americans have it. What's more striking is that the awareness of kidney disease is very low. So only 10% of people who have stage 3 kidney disease know that they have kidney disease. 90% of the people don't even know that they have kidney disease.
So what is considered stage 3 of kidney disease?
That's a very good question. Kidney disease is divided into 5 stages. Think of your kidney function as 1 to 100%. So stage 1 is kind of normal. Stage 2 is 60 to 90%. Stage 3 kidney disease is 30 to 60% of your kidney function. And stage 4 is 15 to 30%, while stage 5 is also called end-stage kidney disease. That's less than 15%, and that's somewhere in that range when people need a kidney transplant or to go on dialysis.
So you can have stage 3 kidney disease and not be aware of it?
Correct.
So how is it detected then?
It is detected by simple blood and urine test. And most of the time, those tests are a part of the regular blood work. So National Kidney Foundation is actually spearheading a campaign across the United States, partnering with various labs and healthcare organizations to promote awareness campaigns so that we can make a kidney profile which checks for the GFR, which is the kidney function, along with a simple urine test to diagnose and classify kidney disease.
So are you saying when you go in for your yearly physical and you have a cholesterol check, that blood test is not going to reveal whether you have kidney problems or not?
It can detect. So we check kidney function by a lab called creatinine. And we use a formula to calculate the kidney function from creatinine, which is reported on the labs. So it's a very simple blood test, and it's a part of one of the routine labs that is done.
Now, we're in the middle of this coronavirus pandemic. Are people who have kidney disease more susceptible to contacting COVID-19?
Americans living with chronic kidney disease, especially patients on dialysis and transplant recipients, are at increased risk of severe infection and mortality from COVID-19.
Yeah. So and also people with chronic kidney disease, they are any people with chronic medical conditions, heart conditions, kidney problems, they are at high risk. especially the transplant patients, because they take medicines to lower their immunity to prevent rejection. And dialysis, people who are on dialysis have low immunity as well. So those are all population at higher risk for contracting COVID-19 and also getting more sick from it.
So what do you suggest then? If you have a kidney problem, you definitely want to stay at home. You want to stay away from crowds. You want to stay away from people, correct?
Yes. Also, recognize in community, if you know somebody, family or friend who has kidney disease, is a transplant recipient, is on dialysis, then maybe figure out ways to help them by picking up groceries from them and delivering it outside their home, where they can pick up, or helping people out as community. So that would be a good suggestion that I can think of.
Doctor, how important is wearing the mask when you go out in public? So
current CDC guideline is number one, social distancing. That is the main thing which prevents the spread. However, the CDC has recommended that if you do have to go out and you can't maintain social distancing, like going to a grocery shop, then you can wear a simple homemade face mask to prevent spread of infection in case you yourself are asymptomatic carrier or person who has coronavirus, so that when you breathe out or cough or sneeze, you're not spreading the infection, because the coronavirus, when you cough and sneeze, it becomes airborne, which can linger around in the air for many hours. So it's mostly to prevent infection to other people.
Thank you, Doctor, for sharing that information with us today. And Kathleen, thank you for being on. And we'll remind people that the Mid-Missouri Kidney Walk has been rescheduled for what date again?
It is going to be Sunday, September 27th at Stevens Lake Park.
Okay. And for more information, the website is
donate.kidney.org/MidMo Walk.
Thank both of you for coming on today. We're out of time. We'll see you tomorrow on Radio Friends.